praying. It's like there's someone that is praying.
Say too much. Let's go.
Welcome, my name
Hello,
is Hayley.
welcome to the day in the life of, us, Major Tech, where innovation is
Guys, you
one of
came
the
late.
things-
Let's start.
I mean,
We're in-
hi. So, in our project, we are focusing on a powerful stakeholder that's making a real difference in the South African healthcare landscape, Mpilo Mobile. Mpilo Mobile is a social enterprise that brings accessible, affordable primary healthcare services directly to underserved communities. How? Through mobile pop-up clinics that operate in rural, urban, and peri-urban areas. Their mission is simple but impactful: to ensure no one is left behind when it comes to healthcare. They offer vital services like health screenings, maternal and health support, vaccinations, and health education right where people live and work. This saves people from traveling long distances just to see a nurse or doctor. What makes Mpilo Mobile so important as a stakeholder is that they are on the front lines, engaging with communities every day and directly tackling South Africa's healthcare access challenges. They are not just providing care, they are building trust and empowering communities to take charge of their health. So, in our project, understanding Mpilo Mobile helps us anchor our work in real-world impact and design solutions that actually make sense to the people they serve.
Mpilo Mobile represents one of Africa's most innovative approaches to healthcare delivery, a mobile clinic network bringing medical services directly to communities across South Africa, Botswana, and Kenya. But behind this promising model, significant operational challenges are creating bottlenecks that limit its potential. Right now, patients in urgent situations face critical barriers with no direct digital channel to request emergency care or home consultation from Mpilo Mobile's team. I mean, imagine not having to worry about the elderly in the case of a stroke. Another hindrance is the reliance on paper-based records. This creates another layer of complexity, forcing medical staff to work with fragmented patient history that compromise care continuity. Now, it's no secret that healthcare information is quite confidential. What is known as the HIPAA Act in the USA has an equivalent in the National Health Act as per the South African Constitution. The paper-based approach with redundant data collection is quite vulnerable. What's more concerning is how outdated systems are draining resources. Clinicians wasting hours on manual paperwork instead of patients, vehicles following inefficient routes that burn through the fuel budget, and preventable administrative costs eating into funds that could expand services. These aren't just minor inefficiencies, they are systematic gaps holding back what could be a transformative healthcare solution. Now, these are the main hindrances of Mpilo Mobile, and once these are addressed, the potential is limitless.
To address the challenges faced by Mpilo Mobile, we are planning to design a digital solution that will completely transform operations at Mpilo Mobile. Firstly, we are going to focus on improving coordination. By digitizing patient records and integrating systems, we allow healthcare workers to access patient history instantly and prioritize care based on the severity of symptoms. Secondly, our solution enables optimized resource allocation. We are planning to use data analytics so that mobile clinics can be strategically deployed. Thirdly, we would like to introduce better data management. We want to offer structured workflow and digital record keeping to replace inefficient paper-based processes. And finally, we would like to provide stakeholder access that offers role-based dashboards. Whether it's healthcare workers, managers, and other stakeholders, each user gets tailored insights and control based on their responsibilities. Now let us take a look at some of the key features that bring the solution to life. The first feature is a mobile app that provides a simple interface for nurse practitioners to easily capture data on site. Secondly, we will have AI-driven diagnostics that will help support medical staff by analyzing symptoms and generating diagnostic suggestions. This will help speed up clinical decisions and improve accuracy. Another essential feature is fleet and resource management. With GPS tracking and fuel optimization algorithms, we are able to plan better routes, track vehicles in real time, and reduce operational costs, which are essential for the mobile clinic deployments. In conclusion, these features will work together to enhance Mpilo Mobile's processes so that they can increase effectiveness and offer quality healthcare.
Let us take a look at our business model canvas. Any successful business relies on strong partnerships, and with Mpilo Mobile in particular, partners such as government health agencies, NGOs, and international health organizations provide essential funding and support. Additionally, technology providers support the development of secure digital tools that enhance service delivery. The key activities include developing and maintaining solutions to streamline operations and communication, training healthcare workers on digital tools, partnering with governments and health organizations, and optimizing the mobile clinic's logistics for better and efficient deployment. Naturally, these activities rely on the right resources to keep things running smoothly. These include mobile clinics and medical supplies, which are at the heart of service delivery. In addition, a secure digital infrastructure with encrypted communication, a secure database, and the use of consent mechanisms. Other key resources include trained healthcare professionals and strategic partnerships for funding and scalability. Now, when all these components work together, the value to both patients and healthcare teams becomes clear. This entails the delivery of care directly to communities while making the process more coordinated. Teams gain tools for faster coordination, tracking patient history, staff activities, and medical resources. Patients also benefit from stronger data protection and transparency, which builds trust in how the information is used. Of course, delivering on this promise means being intentional about how costs are managed. Operational costs such as staffing, outreach, and supplies are a priority. Alongside these are investments in the digital platform, covering development, maintenance, and training. Now, these are just 5 of the 9 points I've discussed so far. I will now hand over to Mr. Kazan.
Our approach is really about supporting Mpilo Mobile in delivering connected, accessible healthcare in a way that's both sustainable and scalable. So who will Mpilo Mobile be reaching with this solution? This digital structure will serve a mix of users, including diverse communities, healthcare professionals, mobile clinic operators, and government healthcare agencies. And when it comes to building relationships, Mpilo Mobile will be able to deepen community engagement through trusted networks, forming a solid partnership that actually make a difference on the ground, not just ticking boxes. Here's how users will access the system. A website that provides information and service access, a mobile app that manages patient records, helps users locate clinics, and supports basic diagnostics, and a connected healthcare network that links clinics, professionals, and patients in real time. Now, how does Mpilo Mobile sustain all this? Through partnerships with government and NGOs, by collaborating with research institutions, offering anonymized, data-driven health insights, and by integrating a doctor-on-demand service, which expands access to care and introduces a consistent revenue stream. To wrap it up, this isn't just a new tool. It's a full digital solution that enhances what Mpilo Mobile already does. It's designed to scale, to connect, and to strengthen their impact now and in the future.
Today, I'll be discussing the SWOT analysis from Mpilo Mobile's digital transformation journey, with a special focus on how we navigate regulatory compliance in South Africa's healthcare landscape. Mpilo Mobile's foundation is robust. We have an established network of mobile clinics and strong partnerships with local communities and healthcare providers. This strength positions us as a trusted name in delivering accessible healthcare. Our digital transformation will amplify this by integrating AI-driven diagnostics and real-time fleet management, ensuring we stay ahead in innovation while maintaining our grassroots impact. Like any ambitious initiative, we face challenges. The high initial development costs and infrastructure limitations. However, these are not insurmountable. By prioritizing scalable solutions and phased rollouts, we can mitigate these weaknesses while staying compliant with local regulations and non-negotiable aspects of our operations. The demand for digital healthcare in Africa is growing exponentially. Mpilo Mobile can expand into new regions and leverage public-private partnerships to scale our impact. But there is a key. Every opportunity must be pursued with a deep understanding of regional healthcare regulations. In South Africa, this means adhering to the laws like the Protection of Personal Information Act, POPIAC, for patient data privacy, and the National Health Act for clinical standard. Compliance isn't just a box to tick. It's the backbone of patient trust and operational legitimacy. We operate in a dynamic environment with regulatory complexities across borders and cybersecurity risks. Competition for global telehealth firms is rising, but our differentiator is our localized approach. To counter threats, we must proactively engage with regulators, invest in secure systems, and ensure our AI tools meet South Africa's Health Products Regulatory Authority standards. In summary, our SWOT analysis isn't just a checklist. It's a roadmap. By leveraging strength, addressing weaknesses, and seizing opportunities while anchoring every step in compliance, Mpilo Mobile will not only transform healthcare access, but also set a gold standard for regulatory adherence in digital health. Together, we will prove that innovation and compliance can go hand in hand to make healthcare a fundamental right. Thank you.
Well, after talking about this wonderful solution, now I will present our plan for the Mpilo Mobile system. Our goal is to deliver a scalable, secure, and user-friendly platform that transforms healthcare management. And here's how we'll achieve it efficiently. We've worked on a project timeline, and we've subdivided our project timeline in 8 phases, which are the planning and the setup, the core backend, the front end, the AI cloud, the notification and real-time chat, the security and compliance, the testing, and finally the deployment. As you can see on the tape right here, the planning and setup will take us 2 weeks. In this phase, we're going to finalize the architecture, to set up the repos, and to assign roles to the team. The core backend and the front end will be done at the same time in 4 weeks. Here we're going to work on CRUD functionalities, on integrating APIs, encryption, authentication, and all those things. And for the front end, we're going to design our mobile app, the dashboard and UI, and also the navigation to make the app user-friendly. The AI and cloud, we're going to use the Gemini API to make it easier for us. Maybe use the Google Vision and the Firebase for storage, and also for all our authentication services. The notification and the real-time chat will be implemented within 2 weeks. And here, we're gonna set up an in-app messaging to help the end user of our app to communicate. Security and compliance. Here we're gonna make sure everything complies with the POPIA and the National Health Act of South Africa. and this can be done within 2 weeks. There's testing and bug fixes will take up to 3 weeks. Here we're gonna, of course, have the user feedback and also, why not, your feedback as stakeholders. The deployments and hosting will take up to 1 week. We'll use Versal and Firebase for hosting. Why not adding a Docker? So we expected to finish this project within 16 weeks to have a functional prototype and a scalable MVP. Of course, you're asking yourself, how can we do that? To meet timelines without compromising quality, we'll run back-end and front-end development concurrently. While the back-end team builds APIs, authentication, and databases, the front-end team will design interfaces and workflows. This saves us up to 4 weeks versus sequential work. And then within 8 weeks, we'll have a working prototype with core features such as patient registrations, doctor dashboards, and real-time data sync. Early testing ensures we refine functionality before adding AI and compliance layers. And then by week 12, we'll have integrate AI for chatbots and prescription digitization, reducing manual work, especially for vitals results interpretation. Predictive analytics will follow in later updates. Security in this plan isn't just an afterthought. From day one, we'll implement encryption, role-based access, and audit trails to meet HIPAA GDPR standards. Beyond global standards, we are going to rigorously comply with South Africa POPIA and National Health Act. Our timeline is aggressive but achievable. Thanks to parallel workflows and proven tech stacks, we'll prioritize transparency with bi-weekly demos and adjust based on your feedback. Let's build a system that empowers patients and doctors efficiently and securely within Mpilo Mobile. We are the people for the people.